First one is Health and Sport. Question number 1, Ruth Maguire.
Thank you, Presiding Officer. To ask the Scottish Government how many take-home naloxone kits have been supplied by the Scottish Ambulance Service since 2011.
Joe Fitzpatrick.
The Scottish Ambulance Service responds to many potentially fatal opioid overdoses by directly administering naloxone to reverse the overdose and save a life. I'm pleased to announce that the Drug Death Task Force will support a 3-month trial, providing 500 naloxone kits to the Scottish Ambulance Service, enabling their paramedics to issue patients at risk of an overdose with this potentially life-saving medication to take home. I visited the Scottish Ambulance Service station in Springburn this morning, and I'm pleased to be able to report that training is almost complete and this trial is expected to start next week.
Ruth Maguire.
Thank the Minister for that very welcome announcement, Presiding Officer. These are preventable accidental deaths, and these actions will save lives, and they're lives worth saving. 514 naloxone kits were handed out in North Ayrshire in 2019. 45 lives were reported saved. North Ayrshire is training additional community development staff to administer this life-saving drug. Will the Minister join me in commending this action and urge others to follow suit with urgency?
Joe Fitzpatrick.
I absolutely would add my commendation to the actions and to the work. And it's something that is replicated across Scotland. Improving the provision of naloxone has been a key focus of the early work of the Drug Death Task Force, and improving provision of naloxone to the most vulnerable people, for instance, through the winter shelters, the work with the Scottish Ambulance Service, and amongst other people who come into direct contact with some of the most vulnerable people, is a very clear way that we could potentially save lives.